Esquire Martin Chosen.
Honourable Speaker, I am very proud to rise in the House today to talk to this motion in support of this motion. In fact, I have wanted to have this message heard at the highest level for many, many years. In my constituency of Esquire Martin Chosen, there has been a chronic and now urgent need to improve key services, especially in the area of mental health. My constituency is one of the fastest growing communities in the province. The community is full of families, many the working poor. They've experienced ever-increasing hardship over the last 16 years, and those with mental health concerns have struggled even more. In spite of the growing population, the community did not experience an increase in services to match the growing need. Indeed, the community experienced cutbacks to community social services. In West Shore, Child, Youth and Mental Health Services has a wait list of over 12 months. Would that be acceptable if these youth had a physical injury? Indeed, the wait list is such a barrier that local professionals and families no longer bother to refer to the service. So then they are referred to the only local community social service organisation, who ends up with 50 youth waiting for service, which is overwhelming for a small non-profit. And in the end, these youth fall through the cracks. Further, the West Shore Adult Mental Health Community Service, which for years had offered community-based clinical individual service to over 100 individuals a year, was eliminated. In the 3 years that followed, the West Shore RCMP reported an increase of incidents related to mental health by 50%, effectively resulting in the near criminalisation of these people in the community because the service was cut and people who needed and wanted help could not get it. A young woman in my constituency suffered through her childhood, and as an early teen, her mum was murdered by her dad, who then killed himself. In spite of being a victim of such tragedy, she built her life with resilience. She stood up against domestic violence, she resisted drugs, and eventually she took her daughter to live with her alone. As a young adult and single mum, she recognised that her trauma continued to have an impact on her life. And she needed support, she needed help to recover, and she approached a local counselling agency. She was entitled to fully paid counselling. She was ready to attend counselling sessions. She would organise her life to fit this in, and she was ready for the journey of healing from her trauma. Yet she could not find resources. Our community had experienced such cutbacks that local counselling services had not been able to survive. And those who had were under such demand, their wait list was so long, it was not even ethical to be taking personal details, Madam Speaker. This young woman sought counselling in that moment, and nothing was available. She is now hopeful. She's hopeful that there will be more investment with our new government in services that promote the health and well-being of people like herself, that will enable her to achieve her potential as an individual, keep her job, and be the best mum that she wants to be. She needs improved services, services that are locally accessible, services that are convenient for her, services that meet her need when she's ready, when she actually can take the initiative herself and organise her life to take advantage of services and to recover and to improve her own health and well-being. She needs services that fulfil the pledge of ask once, get help fast. She needs to know from her government that help is on the way. That is the promise of this new government. That is why I totally support this motion. I thank you, Honourable Speaker.